Thank you all for joining us here today. Before I get into the event directly, just want to shed a little bit of context on why we're talking about youth led action, mental health, and climate change. Even without the added strain of climate change, there's a stark gap between mental health needs and available services, especially in low and middle income countries, where less than 20% of those seeking care receive adequate support. Climate change threatens to widen this gap as vulnerable populations face escalating mental health challenges from extreme weather events, involuntary migration, and chronic stressors. The mental health impacts of climate change are both direct and indirect. Extreme weather events like floods, fires, and droughts trigger trauma, while indirect effects such as land loss, migration, and food insecurity create chronic stress. Rising temperatures are linked to increased rates of depression, anxiety, PTSD, and even psychiatric emergencies. For every 1 degree Celsius rise, mental health related deaths increase by 2.2%, while hospitalization rises by nearly 1%. These inequities are deeply entrenched in how climate change affects mental health, especially in low and middle income countries in the global south who have contributed minimally to the greenhouse gas emissions. They face the harshest impacts due to rapid warming, lack of infrastructure on natural resources, and these vulnerabilities leave them less equipped to manage the cascading mental health crises exacerbated by climate change. This growing evidence calls for immediate action to address both emotional toll and clinical mental health impacts of climate change, especially in communities already grappling with systemic inequities. Welcome to our event, showcasing impacts and youth led action on mental health and climate change. This event is brought to you by Imperial College of London, the University of West Indies, American Psychological Association, Climate Care Center, the Health Working Group of YOUNGO, the official children youth constituency to the UNFCCC, United for Global Mental Health, the George Institute for Global Mental Health, the Office of Climate Change and Health Equity at the US government, and SustyVibes. Next slide, please. I am your moderator and speaker. My name is Harshita Umesh, and I'm the co-contact point for the Health Working Group of YOUNGO. We also have our speakers, whom I would request to raise your hands and wave. Dr. Emma Lawrence from the Climate Cares of Imperial College of London, Dr. Mercian Daniel from the George Institute, Dr. Amanda Clinton, who will be joining us online from the American Psychological Association, Ayomide Olude from SustyVibes, Dr. Alessandro Massazza from the United for Global Mental Health, and Dr. John Balbus from the Office of Climate Change and Health Equity. So, while I gave a very dark introduction, I want to change it and pivot it to the power of youth and why we're talking about climate change, mental health, and the young people. This particular picture was actually taken when we did the Connecting Climate Minds regional dialogue in India. And this was the happy faces of the youth right after we did the dialogue, and they spoke about how they can really work towards the impacts. So, when we talk about the impacts of climate change on mental health, it's not just eco anxiety or nostalgia. For those of you in the room who don't know what eco anxiety is, it's basically the anxiety about the changing ecological conditions and the environment that's around us. And nostalgia is the nostalgia for the environment that used to once be. But the conversation has really moved forward from there. It's really moved forward to the everyday impacts on our lives on the ground. Do I have access to safe drinking water? Am I able to breathe in the air around me? Is my land going to be lost due to disaster? Am I going to have to migrate every single day? Or what's going to happen to me tomorrow? And this is a picture from a child drinking tap water, which we all know is not really great. What I want to pivot this to is that when we talk about systemic inequities that actually affect mental health, and climate change is actually exacerbating it. So it's all those different factors, social cultural with communities, social capital, stability, the environmental events such as disasters, industries, conflicts, and wars Right now, we see so much of funding for the ongoing conflicts and wars, whether it's in Palestine, Congo, and genocide. But the same things, we're not seeing that kind of commitment to the actual climate action that we need. The neighborhood and infrastructure around us, or the economic recessions and the economic inequalities, or the population diversities, because each of us experience mental health in different ways. But that also makes it seem that if you have so many social determinants of health that's affecting mental health, then that means mental well being is built into our everyday lives. And just having these small impacts, whether it's at the individual level, the community level, or the social structure, can create a ripple that actually permeates into our systems, which is resilience, life skills, self esteem, social support, just a sense of community and well being, or the living environment around us. So what we did at YOUNGO was to really try to break the conversation on mental health and tell people, hey, do you know if you feel the impacts of climate change? And we had this bingo that we released during May, which is the mental health month, and talked about it from all the way from the negotiations to arguments about CO2, thinking about extreme weather events, had a hard time writing reports, and just trying to bring this into the everyday lives of what do you do as a climate advocate or a climate activist? But we also try to pivot this and did this with SustyVibes, which I think Ayomide will shed more light on later on, which is the Eco Anxiety Project, where we try to show every day how are you building resilience in your communities? What are the stories that you share? And what are the small things that you're doing to keep hope for the better tomorrow? And we try to expand this, and we had inputs from across countries, whether it was the Asia Pacific, Latin America, or even Africa, where people were saying, oh, we have these coping strategies that are part of our everyday lives. And I think we're not so alone anymore. So we're part of this community. We also joined with the Billion Minds Institute that is run by Dr. Gary Belkin and his team, where they actually made a roadmap for care to change. And this was actually in line with the Sharm el Sheikh agenda for adaptation, where you actually see that the Marrakesh partnership that's present, that you have like 7 systems where you have cross-cutting enablers. So you have resilient food systems, you have natural systems, human settlement systems, coastals and oceans, infrastructure systems, and the permeating, which is like the planning and the finance that really leads to this. So, how can we tap into financing psychological resilience to be a part of our climate resilience? I'm going to hand it over now and say that we are all here together and we're 1.8 billion voices because that's the number of young people that are present today. But YOUNGO alone right now has over 200 young climate advocates sitting in negotiation rooms, speaking at side events, taking part in protests. And we're all part of this community. This picture was actually taken last year during COP28, and we had a picture a couple of weeks back, which is still not in circulation. So to anybody who's 35 and under, or if you know somebody who's 35 and under, join YOUNGO and be part of this movement and actually work with us to have collective action. Thank you.
Thanks so much, Harshita. So I'm from the Climate Care Centre. My name's Dr. Emma Lawrence. Thanks. I can see people keep coming into the room. Really appreciate you all being here today. Now, this is really tricky. There we go. So just going to open with a quote from one of the young people we spoke to in a Connecting Climate Minds dialogue. And they said, so the future is not bright. It is black rather than bright. This is one negative impact. And they went on to describe how people were dying by suicide because of this compounding stresses and distress and not being able to see that bright future. So we urgently need, and this is the words of the Lancet Commission on Global Mental Health and Sustainable Development, we need an environment that fosters mental health and well-being for all. And what I would add is that the climate crisis gravely threatens this vision. Climate change and mental health are 2 global crises. Youth mental health has been termed a dangerous trend that we're seeing. The Lancet Psychiatry Commission on Youth Mental Health just this year has said that mental ill health, the leading health and social issue impacting young people, has entered a dangerous space. And they pointed the finger at many, at the poly crisis effectively, these interconnected and compounding stresses on young people including global megatrends like the changing climate. And they urged promotion of good mental health and preventative early intervention and action. They urged urgent action. And this is similar to what we hear from the climate scientists who desperately, increasingly, are trying to warn humanity of the cliff edge that we're trying to topple ourselves over in potentially breaking through tipping points and creating an irreversible and escalating cycle of global heating and breakdown of the climate systems. So any further delay in our action will miss a brief and rapidly closing window of opportunity to secure a livable and sustainable future. If you're a young person growing up today and you hear these kind of things, what does that mean for how you see your future? And what we need fundamentally is resilience to cope with and process this information, to cope with the challenges and hazards we face, and also to take action. And the International Panel of Climate Change say that resilience is not just the ability to maintain essential function, identity, and structure, but also the capacity for transformation. And I would argue that that is something that is fundamentally around mental health and psychosocial resilience. So just as a taster to build on what Harshita kindly shared about why we see the climate crisis as a massive risk multiplier for this ongoing youth mental health crisis. 75% of young people across 10 countries surveyed say that the future is frightening. But as I've heard from young people here at COP, it's not just the future. We keep talking about the future, but it's also the now. And not only the now that they're facing in compounding stresses, but the now that they're facing in trying to make change and being frustrated by the systems that are not listening to their voices. We also know that this is intergenerational and ongoing. So there's emerging evidence that exposure to air pollution, including from wildfire smoke, for instance, but also fundamentally from burning fossil fuels, exposure in utero in early childhood can increase this lifelong risk for neurodevelopmental disorders, depression, psychosis, etc., etc. We know more people die by suicide on hot days and polluted days. And similarly, exposure to extreme temperatures, even in early childhood, changes the way young people's brains develop. It changes the white matter structure, and again, is predisposing them to potentially lifelong challenges. So this is this disruption of these, what we know and we fundamentally know from mental health is needed for good mental health and well-being. And in the words of young people, one young person in our dialogues, the impact of climate change on our learning environment exacerbates existing mental health issues, limiting possibilities, well-being, and educational capacity. We heard parents saying, our kids go out and play, but our schools are shut. They can't go to school. Another, in the voice of another young person, it's hard enough to cope with existing social problems, livelihood challenges, and physical and mental health problems, without also fearing for when the next climate event is going to strike, or opportunities will no longer be available. So we heard again, this is not, it can't be siloed or compartmentalized into one impact or pathway, but a compounding, interacting stressor. So I would argue that at the moment, in terms of securing the rights of young people, safe and livable future where they can thrive, which is what we hear they want, that decision makers are currently failing at that. We heard yesterday from young people that the need to join together intergenerationally, to not point the finger, to make sure we're having constructive dialogue. But that means, and again, the voice of the young person, why does our heart break? That feeling of no one is getting it. Government is doing it. And this isn't just feeling and experience, it comes, if you want to put it in those terms, to the economic cost. So it's been estimated that the increased mental health burden from climate hazards, air pollution, and lack of green space alone costs $67 billion US by 2030, but that will accelerate estimates to over $500 billion by 2050. That's not including going through tipping point. So my nephews will experience 7 times the number of heat waves as my parents did, and I'm from a hot part of the world. And so all of those impacts that we've heard will only. And I knew that we've all come here, so I'm probably preaching to the choir. There is this potential, once we see the interconnections, for a virtuous cycle, where we can start to see that programs and interventions that foster resilience that support with mental health and support the conditions for good mental health are hugely aligned with what we need for the climate. So climate action is mental health action, and vice versa. We know that mental health benefits from involvement in participatory and collective climate action. We know that if we strengthen communities, that I was just at the International Congress of Psychiatry, social connection is one of the best things you can do for health and mental health. Also what we need to cope with and act on the climate crisis, and to try to address current power imbalances right in the crisis. We need the integration of climate and mental health education and strengthening opportunities. We need to, the changes that would actually fundamentally stop burning fossil fuels, reducing inequalities, and doing that in a fair and funded way. Countries with higher inequalities have lower well-being and higher emissions. Reducing inequalities, reduce air pollution, increase workplace access, increase etc. will get huge benefits to mental health. So we think we need connection of these different disciplines, these different sectors, these different divisions. So we have funding from Welcome to create Connecting Climate Minds. This was structured fundamentally around connecting people. So we had regional community teams in all 7 Sustainable Development Goal regions, with conveners, co-conveners, the different advisory group members, and youth ambassadors, a lived experience working group who led work by and even for young people, Indigenous communities, small farmers. More about that from I know, SustyVibes, and the Climate Care Centre and Red Cross Centre provided global coordination. So we were trying to balance this global really down to local. So this is just the conveners in each region, but then they worked with people all across their regions, co-conveners, people from different disciplines and sectors. So it's truly very transdisciplinary and centred lived experience at every part. So through dialogues in all of these regions, we had over 900 people participate in many, many hours of dialogue, and all of those insights generated regional research and action agendas and community-led research and action agendas, and all of that was synthesized into the global research and action agenda. Where actually, I think it went on to, sorry, I'm going, I'm struggling with it. So what we learned at a global level is just some of the insights, but what we were trying to do was understand what evidence is missing that policymakers might need to act on these effects, because we know there's big data gaps. Even the evidence we know, we don't have that in all parts of the world. And the action agenda is how do we take that research and that evidence and make sure it actually makes change, connecting what we know with what can be done. Some of the insights at a global level is just how compounding and interactive there's these very big multitude of interacting pathways and mechanisms are, but how much does relevant knowledge and solution and how much resilience there is in diverse disciplines and cultures, and also diverse expressions of mental health and well-being, of different ways of understanding and coming to terms with the changing climate, and the need to really understand that holistically and create a climate and mental health field that doesn't perpetuate existing inequalities. From the youth agenda, which we'll hear more about, this was written by young people and colleagues of IO. Just some of the priorities, there's so many in there, but needing to again have terminology that resonates with young people who are affected from different places, and explore the temporal and evolving nature of the different impacts psychologically and different traumas, because we don't have that sort of longitudinal data. And identify climate actions that integrate or align with mental health benefits for young people, to invest in services that are mental health services, but that are also climate aware, climate responsive, and include youth voices in policy making and climate actions. That in itself is a mental health intervention for many of these young people. So I would say that it's rather than being in a way a cause for concern that young people are distressed about the state of the world, they are showing us what's wrong with our society. And the Lancet Psychiatry Commission on Mental Health this year said that young people are showing the most serious warning signs and symptoms of a society and a world that is in serious trouble. So we need to those of us who are not in the youth bracket anymore, need to stand up and listen and fundamentally connect together. And I hope you will join us at Connecting Climate Minds. Check out the hub for all of the agendas, the experience stories from around the world, case study, toolkit, a collaborate area where you can sign up and connect with others. So thank you very much. I'll pass over to Alex. I'm passing over to sorry, I'm passing over to Mercian. Okay. Yeah,
I'll straight away go into the impact of climate change on young people in India and Hong Kong. There's very little evidence, like Emma was saying, especially from the South, and from low and middle income countries. I'm a senior research fellow at the George Institute. Just a brief about the George Institute. It was founded in 1999 in Australia. It's an independent research institute with offices in UK, China, and India. I belong to the India office. Our mission is to improve the health of millions globally through impactful research. We in partnership with Imperial College London host the NIHR Global Health Research Centers for Non-Communicable Diseases and Environmental Change, and we conduct our research in an environmentally sustainable way. I will be presenting the impact in two parts. One, findings from a published study in collaboration with one of my panelists out here, Emma, and a second study, which preliminary findings from an ongoing study. Only. This is not moving. This is not moving. Sorry about this. The first is about the impact among marginalized young people. This was a cross-sectional survey among about 536 young people around age 16 to 24 in urban slums of North India and South India. So this was part of a study again with the Climate Cares group. And just to give a context about young people who live in these slums, experience relative poverty, unsafe housing, poor sanitation, overcrowding, increased risk of crime, drug and substance use, and limited opportunities in health and education. They reported, this was a self-reporting kind of a survey, that extreme weather events had negative impacts while actions for improving the environment had positive impacts. Majority had climate agency, but this did not translate it into action. There were limited opportunities for that. There was some concern about climate change, though this was not very high as these young people were not directly impacted. Also, the level of knowledge and the general awareness about climate change events were limited to an extent. Why is this moving? I'm just struggling with this a bit. You can do it. So you can, yeah. So just to give you a context about the second study which is an ongoing study. This was done in Sundarbans in India. This is one of the world's largest remaining mangroves and wetland. It's home to a large rural community who are very dependent on the ecosystem. The long-term trends of cyclone landfalls over these many years show that Sundarban as the highest impact zones. And there have been 5 cyclones, including a super cyclone between 2007 and 21, causing severe devastation to the area. Just a bit of a context about Hong Kong. Next. Urban heat island effects, where dense environment exacerbates the impact of heat waves. Subtropical climate is becoming hotter and more humid, and there are more frequent and severe heat waves. There is growing evidence from this part, at least, of the region. Unlike from India, there is no evidence whatsoever. The preliminary findings shows that we did the survey with about a little more than 1,500 young individuals, and from various villages and from various districts of Hong Kong. We found that young people frequently encountered environmental challenges, including cyclones, extreme heat, and reduced access to drinking water. Environmental stresses such as temperatures, high temperatures, air, noise, and light pollution significantly impacted their mental health. Participants expressed concern about climate change issues, unlike the other, where they were not directly affected. Here they were directly affected. So they did express some concerns about climate change issues. And climate related thoughts and concerns moderately interfered with their overall well being. So, based on just a few of these two studies, the takeaways would be that climate change does impact mental health. Interestingly, universally across regions. Also, the type of climate change events were also similar, but also a bit different among both these regions in India and Hong Kong. So, this highlights the need for more mental health research and targeted interventions. Like Harshita was talking about social determinants, so socioeconomic factors which actually influence life satisfaction and mental health should be integrated into climate change and impact and adaptation research. Environmental conditions which are very specific to urban and rural living may exacerbate mental health challenges and calls for improved urban planning, rural development, and environmental management. Related to the first topic, emotional responses to climate change and environmental degradations are critical areas for mental health research and intervention. I would just like to acknowledge the fund, the collaborative research fund that funded the second study, my colleagues at the Chinese University of Hong Kong and the George Institute, the local partners in West Bengal and Hong Kong, and of course the Changing World surveys as part of the climate cares. Thank you so much.
Am I audible? Thank you, Mercian, so much for that really lovely insight into what's happening in India and even in Hong Kong and really setting the context. And also thank you, Emma, for really giving us that truly inspirational story about how if we connect, climate minds from across the world and people really listen to what young people are asking for, an intergenerational collaboration will really lead to more successive collective action and outcomes. We're going to pivot a little bit more and listen to a pre-recorded video by our colleague, Dr. Amanda Clinton from the American Psychological Association, and understand why exactly early intervention is so important to prevent and minimize the mental health impacts, and how can we really maximize the financial benefits of these interventions. I mean, this is a finance COP, so it wouldn't be complete without talking about the financial benefits of this. Can you play the video, please?
Good afternoon. My name is Dr. Amanda Clinton. I'm the Senior Director for the Office of International Affairs at the American Psychological Association, headquartered in Washington, D.C. It is an honor to be here with you today to join my colleagues on this important panel, and in my particular time to speak to prioritizing the health of very young children in a world impacted by climate change. The key takeaway in these few minutes that I will be able to share with you is that investment in very young children and families is a vital pathway to improved climate resilience and adaptation. That is that we, as mental health professionals, as mental health advocates, need to be sure to keep in mind the key questions that come up, and this has been a center question in the current COP negotiations in Baku, what we get for the money we put into addressing the climate change problem. When we invest in very young children and their parents and families, what we see is a significant outcome and strengthening of humanity long term. So what we know about very early childhood is that the first 1,000 days of a child's development are extraordinarily important to their long-term trajectory. These first 1,000 days, which is almost 3 years, are a window during which children show extremely rapid and significant growth in brain development, in cognitive thinking, problem solving, in social understanding and environments, emotional management, and even labeling and reflectiveness, and physical growth. These all occur together and are critically important to the long-term outcomes of children when they move into adolescence and adulthood. That is, there's significant psychological science that has demonstrated how much of a contribution positive early childhood development makes to success, as we typically define it, education, positive relationships, etc., during adulthood. So these first 1,000 days are ones of profound vulnerability. If we have children and families who are impacted by adverse climate events, that is going to have significant impact on their long-term growth, even if their opportunities are basically those of a typical childhood. If we look at children who are already growing up in challenging circumstances where they have fewer economic resources, fewer educational opportunities, fewer equity opportunities in terms of gender or special needs, those actually become exacerbated. So where disruptions and emergencies happen, which is common in the climate change environment, what we will see is an extreme level of vulnerability in children and their families, which long term means that their growth trajectories, socially, emotionally, cognitively, and physically, are extremely negatively impacted. What we look at when we talk to lawmakers about the value, when we talk to policy leaders and negotiators in environments like COP, is that one of the best investments we can make in terms of human resilience, human ability to problem solve and overcome significant challenges, is when we put money into children and their families in their first 3 years of life. These are just two graphics. There are many of these. This is a particular report, but if you look at some of the numbers, you get a sense of how $1 invested in a preschool program, 2-3 years of age, has somewhere between a $6.50 to a $12 return, may as much as 12 times increase in the investment we're making. Also, if you look at long-term investment for outcomes, that initial investment of $1 and the initial outcomes are quite positive. But what it also means is lower investment over time. So the second graphic demonstrates how when you invest between 0 and 3 years, ultimately there are fewer economic resources required for education, for job training, for societal, civil society kinds of programs and efforts. So there's a short-term positive investment outcome and a long-term positive investment outcome in the sense that it is not necessary to make the same kind of investment we end up making in terms of resilience and coping with climate disasters and the mental health consequences if we have prepared children adequately very early in their lives. In summary, an investment in early childhood has significant long-term outcomes in terms of resilience while we are trying to address one of the key problems of our time, and that is the mental health consequences of climate change, the disasters, and the uncertainty that come with that. Thank you for your time, and I appreciate the opportunity to speak with you.
We've heard time and again that children are not little adults or little people, and I think this really underscores that importance and that really highlights the unique vulnerabilities that children actually face. So I'm really glad that this year we had the first ever expert dialogue on children, and we're continuing to have that dialogue and talk about the need for actually realizing the unique impacts of climate change on their development, and not just their mental well-being, but their psychosocial well-being as well. We're going to go over now to my colleague Ayomide, who's going to share some case studies of what young people are doing in countries that SustyVibes works at and really highlight the potential of truly prioritizing and funding youth-led initiatives and the kind of impacts that that could have for the societies and the communities that we are a part of. Could we please go back to the slides? We got them? Great.
Okay. Thank you, Ashita. Yeah. Okay, great. So my name is Ayomide Olude, and I'm from Lagos, Nigeria. And today I'll be speaking about youth-led interventions on climate change and mental health, particularly sharing our work at the Eco-Anxiety Africa project at SustyVibes and work from some of our friends around the world. As previous speakers have mentioned, the various ways climate change impacts the mental health of individuals, particularly young people and children. In my presentation, I will share how young people are beginning to understand the mental health impacts of climate crisis and how they are now looking for change and solutions. Second slide. So SIP began as a subsidiary project under SustyVibes, an organization focused on making sustainability actionable for young Nigerians. And SIP was founded because a community of young African activists began to recognize the mental health toll that is part of environmental activism. But beyond the activism also, they were also experiencing climate change impacts and events such as flooding in Lagos and the drying up of Lake Chad in northern Nigeria, which directly impacted their lives and therefore their mental health. After a survey in 2022, TIP recognized that over 60% of young Nigerians were experiencing similar levels of eco-anxiety and 40% of which had no access to support. At TIP, we recognize the unique manifestations of eco-anxiety in Africans due to varying ways which individuals are directly impacted by the climate crisis, and also the social and political landscape that can limit the ability of young people to access support or believe in long-term change and adaptation. TIP serves as an intervention as we use research, space making, community action, psychosocial support to build resilience in young Africans. And we do this under 4 areas of work. First is via research, and one of our research projects was the Connecting Climate Mind project, and we formed this research by creating a safe space for young people like myself to discuss eco-anxiety, and we used the analysis from these dialogues to develop a global research and action agenda on climate change and mental health. This research includes our analysis of virtual global youth dialogues and our regional dialogues in India and Nigeria. And these dialogues gave young people the rare opportunity to have their experiences understood and validated, as well as the opportunity for them to share how they want to be included in climate research about mental health so that their needs can be reflected in future policies. And their demands also formed the creation of a youth declaration. Next slide. Another of our work area is space making, and we do this through Zen Cafe and also the eco-resilient stories like Ashita mentioned earlier. So Zen Cafe is a conversation-styled gathering held every other month in Lagos, Nigeria. We also have virtual sessions like once every 2 months. And the idea is to create an open and inclusive space for young people to come together as a community to discuss environmental related emotions and also learn transformative tools that can enable them navigate these emotions and transform fear and worry into climate action and hope. Eco-Resilient Stories was hosted alongside YOUNGO Health, and it was a social media campaign that spotlights stories of eco-anxiety and coping strategies from young people in the global south, where we promoted their lived realities. This project not only established a virtual community of youth experiencing eco-anxiety, but it also validated and amplified global south stories. Next slide. Finally, Another work area is community action and psychosocial support. And we do this through SustyVibes parties. So these parties are celebrations that bring Nigerians together to have healthy conversations around environmental related emotions, climate mental well-being, and also other sustainability issues. And one thing that we also do in our events and dialogues, even at CCM, is to have psychosocial supports to support overwhelm and other emotions that may come up when young people are in this kind of spaces. Last. I just want to spotlight, there are several, youth interventions that are going on currently around climate change and mental health. And I've also met a lot of young people at COP who are doing this work. But I'm just going to spotlight this too. The Resilience Project that is based in the UK. And what they do is safeguard the mental health of change makers by resourcing them to prevent burnout. And Climate Youth Resilience, which is a community for young people like myself in the Global South, and it empowers us to adopt inner-led practices that nurture our mental well-being and as we navigate the climate crisis. So finally, I just want to say we don't need to reinvent the wheel. We already have effective interventions. Like I mentioned, TIP is doing work, other young people are doing work across different places. And we're already taking the lead and leveraging our cultural and social context to implement resilience programs for ourselves in the community and shape our future. Thank you.
Thank you, Ayo, for such a great slides and for the great presentation. I just have one question. How can I be part of these Susty parties and how can we all join? I think that looks really cool. I mean, who wouldn't here want to be part of a party that really helps your psychosocial well-being? But also thank you for highlighting the other youth-led initiatives. I think it's really important that we come together very cohesively and try to really bring about this policy change. But I think I'm going to hand that over to our resident expert over here from United for Global Mental Health. Ali, do you think you can tell us how policy needs to change and what we really need to integrate into what's going to be happening in our agendas in the future?
Thanks, Harshita, and thanks everybody for joining today. So my name is Alessandro. I work as a policy and advocacy advisor for United for Global Mental Health. We are an international NGO working on mental health policy and advocacy around the world. And my session, as Harshita mentioned, will try and touch and build on what the other panelists have mentioned to consider how we can translate this evidence into policy and programs. Next slide, please. But before I start, I wanted to begin with a story that comes from a region just a couple of hours north of Baku, here in Azerbaijan. And that's the story of Murad. Murad is a father. He has 2 children. And he works as a farmer. And so his father before him and his grandparents, and he has been living in this era for generations. And at the beginning of 2020, a very severe flood went through his village, damaged his house and his crops, and forced him to relocate, to sell all of his animals and to move houses. And he described to us how his 2 children, life was impacted by this event, how they had to change schools, how they had to change groups of friends, how their psychological well-being was impacted, how their sleep pattern was disrupted as a result of this event, really highlighting how even very close to where we're speaking today, these impacts are being felt on the ground. Next slide, please. So given the evidence that has been presented here, we would probably expect children's considerations, children's mental health consideration to be really central to climate policy. However, unfortunately, that's far from the case. So if we use the example of a recently published paper in The Lancet that looked at how children's health consideration featured into national adaptation policies all over the world, we see that out of 160 national adaptation policies from all over the world, 0 included any reference to children's mental health. And even when we look at health in general, you can see by this map that most countries tended to score pretty low in terms of how children's health consideration appeared within national adaptation policy. So countries in the different shades of red are countries that have low inclusion of children's health consideration within the national adaptation policies. Next slide, please. This is not unique to either children's mental health and national adaptation policies. So if we look at other types of climate policies, such as national determined contributions, this is data from the World Health Organization on the right, and you can see how different health outcomes feature within NDCs. And you can see that mental health is right there at the top and is one of the least included health outcomes within NDC. So only 3% of NDCs have any mention of mental health whatsoever. And you compare that to other health outcomes, such as vector-borne diseases that have a 28% inclusion rate, you can really see how discrepant the approach towards physical and mental health is within climate policies. And that's very much the case when you look at national adaptation plans or disaster risk reduction policies around the world. Next slide, please. Things are changing. So as Harshita mentioned, it was fantastic to see that last year at Bonn, we saw an expert dialogue on how climate change is impacting children around the world, and mental health was explicitly included as part of this dialogue. The African Union Office for Youth published a report in which they identified climate change as one of the 5 major threats impacting mental health of African youth across the continent. Ayo mentioned and Emma, the Young People Research and Action Agenda by the Connecting Climate Minds, and another example of work in this space is the Interagency Standing Committee for Mental Health and Psychosocial Support published a short explainer about how mental health can be integrated within disaster risk reduction policies through the eyes of Mira, which is a young girl living in a rural area. Next slide, please. We are also seeing changes at the programmatic level. So this is a case study that was very kindly offered by UNICEF. And it's about highlighting how increasingly we're seeing youth mental health consideration being integrated in adaptation and loss and damage intervention. So this is an example that comes from Peru. That is a country that is experiencing increasing levels of climate hazards, but also significant migration flows, especially in the northern region. And UNICEF, together with its partners, ensured that mental health and psychosocial support was thoroughly embedded within migrant attention and orientation points, so that when families access these services, they could also access services for their children's mental health, but also for themselves as caregivers. And at the same time, they also organized itinerant brigades, which also included psychologists that were able to reach families that were being affected or that had to migrate because of climate stresses, and to provide psychosocial support to them. Next slide, please. We are also seeing increasing buy-in at high political levels. So these are just a couple of examples from global political commitments that highlight the need to integrate mental health within climate and health discussions. So many of you may be familiar with the COP28 Declaration on Climate and Health that includes an explicit reference to the need to include mental health as part of a comprehensive and holistic response to address climate and health needs. And it also explicitly refers to children and young people as particularly impacted by the climate crisis. Last year in May, we saw the approval of the World Health Organization Climate and Health Resolution on climate change and health. And that was the first resolution on climate and health to include an explicit reference to mental health in the context of how mental health is being impacted by extreme weather events. And finally, I think it's important that we contextualize this within the Convention on the Rights of the Child, which highlights how children have the right to a clean, healthy, and sustainable environment, and how this should really underpin political commitments in this space. Last slide. And given that we're here today at COP29, I also wanted to, I guess, give a shout out to young people themselves, because young people have really been some of the most powerful advocates for the need to consider mental health within climate action. So just out of the 11 side events that, for example, I was able to identify happening on mental health at COP28, the majority of them had a focus on young people's mental health. And not only that, but they were proposed by young people or had young people as panelists. So I think that really highlights the recognition to young people and highlighting this important intersection. And I just wanted to finish next slide, please, with a recommendation, which is about really trying to advocate for the better inclusion of children's mental health consideration within climate policies, such as national adaptation plans, nationally determined contributions, in particular to ensure that children and young people have access to climate resilient mental health services, that these can both prevent and manage their mental health conditions and their mental health needs that are being exacerbated by climate change, but also that they can promote psychosocial well-being and resilience in the context of climate change. So over to you, and thanks for listening.
Just before I hand it off to Dr. John Balbus from the US, I just want to say I'm so glad that you're the one who's presenting these policy recommendations. It gives me a lot of hope. And a shout out to the youth in the room for organizing the number of side events that they have on mental health. But I also love the final recommendation that we're calling for scaling for national determined contributions and NAPs to really include health and especially mental health, because the way it's being referenced is so important. With that, I wondered, Dr. John Balbus, since you are working with the US government, do you think you can tell us how the government is really taking in all of these recommendations, on-ground initiatives, and what they're really doing with it, and also your expertise on it?
Thank you so much, Harshita. Thanks to the organizers for inviting me today. Thank you to this brilliant panel. I've learned so much from your presentations. It's really an honor to be able to go clean up. And yes, I was asked to actually backwards. To answer this question, what do decision makers need to drive change? Okay, so decision makers and driving change in climate and youth mental health. And I just want to start by saying, first of all, my comments are going to echo what we've already heard, because we've heard a lot of good ideas about what's needed to drive that change. But I'm going to be focusing specifically on how do we drive change in governmental programming in this area. I'm going to divide the needs into what is needed for decision make, or what kind of changes have to happen inside government to drive this change, and then what do we need coming in from the outside of government to drive that change. And based on experience in the US, I'm going to focus on two different parts of the government. So part of what we need to drive change is the part of government that creates programming and funds it. In the US, that's our legislature. And part of what we need to drive change is changes in the awarenesses and practices of the people who implement the programs, working within the confines, the space, the authorities of given programs, which are the agency staff. So with that as a little bit of framing, it's buzzing in my hand. There we go. These are some of the ideas that I'm going to share with you. 2 within the government, 3 outside the government. So one of the first points I want to make, and this really does not always respond, the bar is high on this. The bar is high for several reasons. This is a gap area in the government's mental health in general has a bit of a stigma. And to the extent it is dealt with, it is usually dealt with as diagnosable diseases, treatment, and a medical model of treatment. The role of prevention and primary prevention, which is absolutely what we need with youth, right? We don't want youth to go into a medical setting to get cured of their climate anxiety. We need to have programming throughout our health programming, our educational programming, our climate program that is preventive, that builds resilience, that keeps people out of that system. One of the ways that needs to get done is to ensure that the existing program that's addressing resilience, that's addressing emotional intelligence, addressing the well-being of children, the education of children, is climate aware, is aware of the stresses the children are under, is aware of the role of disasters. But vice versa, and perhaps just as importantly, governments do all kinds of things with youth. There's extension programs for rural youth in the United States. There's programs for urban youth, to get engaged in their communities and work in their communities to build social capital. There's getting youth out into nature. There's getting youth into culture. We're always doing things to try to build the well-being, the education, the resilience of youth, and none of it is climate informed. And so much could be done by making it climate informed, especially those programs that are about agriculture or that are about the built environment and tree cover, et cetera, to understand that those youth, as they're doing this work, have this in their heads, that 85% of them in the United States are already upset, and that the work that they're doing, the action they're doing, the empowerment in these programs is actually a part of the solution too, and raising that awareness and also raising the ability of peer counseling in those programs. So two-way integration, behavioral health into youth climate programs and vice versa. The second is that to do that kind of two-way integration, it's not just health. It's not just the mental health agency, right? It has to be an all-of-government approach. In the US, we've got the National Park Service, the Department of Agriculture, the Housing and Urban Development, AmeriCorps, Department of Energy. All of those are involved. And these extremely busy slides are kind of representations from a project that we did out of our office, out of the health department. But we brought together all of the agencies whose logos are there on the left to figure out, how do we do this? How do we do this two-way integration? The gobbledygook on the right is a logic model that shows, what are the things we think we can do with the inputs and, the resources that we have available to us, which unfortunately are very limited in the US government because we don't have that public psychological health model. Can answer questions. I'm not going to go into detail, but again, the point there is it's not just the mental and behavioral health. It's not just the education department. It really has to be multiple agency collaboration. Okay. Ideas outside the government. So this is obvious, and we've heard this already. We need to build the evidence base. As I said, the bar is high. Most legislators, in the United States do not have an idea that this is a phenomena that is affecting youth right now. I would say, and it's not, we always say this, we need the evidence. Everybody says we need the data, we need the statistics. Of course, we also need the stories. And that has really been shown. And we especially need the stories for places like the legislature, for getting people from square zero to square, okay, let's pass a bill to go ahead and fund this. But then inside the agencies, we need to build the evidence base for effective action. And this is just an outtake from a recent, probably the most comprehensive recent scoping review, thanks to Emma and her team, that said that, in the literature, there's very little evaluative research. There's a lot of description of interventions, there's description of the outcomes, but little rigorous interventions and testing, a little work against a framework. So there's a real gap in the evidence base to really make sure we know what are the interventions that are most effective. And I think that's very important, especially inside the government. I don't have a slide for the second thing. The second thing that is needed is advocacy. And by that, I mean, there needs to be a collective voice to bring that evidence to the legislature, especially to create the change. The greatest voice is the voice of the young people. It is the voice of the people who are most affected, who are the ones who will be living in the world of the future. This is what we are all saying here. This is what you are here saying. But we have to have a voice that both raises the awareness, makes people aware of the scope of the issue, and deals with the challenges we have, that deals with the challenge of mental health stigma. As soon as you start talking about mental health, people, a lot of eyes will close. Oh, I don't want to have to deal with that. We need the kind of advocacy that can overcome that. And also the kind of advocacy that can, make a case for a field that, again, is very medicalized. where there's just the professionals in the field have traditionally, it's just starting to change, but have traditionally really been in a model of diagnosis and treatment, as opposed to intervening in well populations to prevent illness. So all of that needs kind of a strategic advocacy. And then lastly, I'm going to come back to the point that Emma made it at the end of her speech, which is that there is a really profound interconnection between one of the root causes and drivers of the distress of many people in the world, but especially young people in the world, which has been documented again and again, which is the observation, I won't say the perception, the observation of failure, the frustration, the disappointment and anger at the failure of government, industry, generation before to do definitive action. That is driving intensely high rates of distress, anxiety, perceived illness that we know translates into serious outcomes of lifelong issues of depression and anxiety, suicidality, substance use. And so we talk a lot about the benefits of climate action, and we always talk about 7 million deaths from air pollution and how healthier plant-based diets will save a lot of illness. Climate action as a fundamental driver of improved mental health and well-being in young people, I think would economically dwarf it, would number of people affected dwarf it. And that is a case that we really need to make and start using this language about, for people by co-benefits. We've been talking that co-benefits for 20 years. It hasn't necessarily caught on, but I think that framing this as the economic impact of preventing that illness, the ethical and moral impact, and just the financial optimization, if that's what moves people, of addressing this problem through climate action, I think is an important message to get to decision makers in all places. So with that, I thank you, and I look forward to our discussion. And Harshita, should I click one more? Do we have a next slide to look at?
Yeah.
There it is.
Just
Okay, there.
quickly. Thank you, John. I think it's always quite powerful to hear from a government representative about what government initiatives exist, because oftentimes as public, we aren't aware of what's present. And that gap was quite well addressed, and also about the multi-agency collaboration that's required and the systemic change that's driving it. But the power of youth and public participation in holding governments accountable, because of course it's always bilateral. But we want to open the floor up to the public right now, and we have quite some amount of time before I give it back to our panelists for our final call to action and our closing remarks. Does anybody have questions? I think we can do 2 to 3. There's one there. Just one? Okay, one there and one there. Could we pass around the mic, please? And I think we can also remove the slides if that's okay. So we'll take all of the questions together so that we can address it together.
Yeah. Thank you so much for your insightful presentations. My name is Mahi Patki. I'm a student at the University of Tokyo. And I was thinking about what the sort of age-appropriate education surrounding climate and environmental issues is for children, as we see that there is such high prevalence of mental health issues. So specifically in children, I was wondering, and I think that this runs parallel to sexual and reproductive health education. We have very age-appropriate introduction at different levels. So I was wondering what your thoughts are on that. Thank you.
Is that directed to anyone, or is it for the panel?
Open to the panel.
Okay.
Another question for the panel. My name is Anna Lim. I'm a social work student from, I'm Filipina, but studying in the United States. And my question is, with mental health, it is a very kind of Western-driven field. And so my question is, what is the progress looking like on the decolonization of the field, as well as the development of culturally appropriate and relevant interventions?
Hi, my name's Igor. I'm from Australia. Hello, everyone. I'm a researcher, but I'm also a high school teacher. Firstly, thank you to the panel for everyone's contributions, and for those two questions that were just perfectly asked. Thank you too. If I could only add to those two questions, with a bit of context, that when I'm in my classroom and we're talking about various lessons, particularly around geography, eco-anxiety is at its highest. I never want to sugarcoat it for my students, but it definitely leads to these conversations where it's like, oh, sir, this world is burning. It's never so good. In that context and following suit, there's a lot of shame, especially in Australia, and stigma of accessing mental health supports, even where it's like, oh, when I see a student struggling, the idea of like, oh, we can have a chat, or, oh, let's go to a counselor or whatever. No one wants to engage with that. So what role, I guess, continuing, can education play in absorbing a mental health response to eco-anxiety, to the intersection between climate and mental health, to make sure that a climate responsive mental health response, that's not worded right, but we'll go with that, is actually embedded within our society and not just a outside program that young people have to reach out to.
Thank you. I think we're going to stop with the questions there, but I'm going to open it to the panel. Does anyone want to take it first? Ayu? Okay.
Thank you. I think I can speak to the second question. Okay. Yeah. I'm going to speak to the second question on the progress of decolonization. Well, technically, when we still look at like education, I don't think the curriculum is changing, right? But we encourage like youth researchers to decolonize like their research around mental health. And even in our space, like Dr. John said, eco-anxiety, it's not a medical issue like for Zen Cafe. So we just like, it is normal for you to experience this kind of feeling. You don't need to visit a psychiatrist except when it gets extreme, really. So we found out that community has really helped people, like Zen Cafe, to express that emotion and try to handle it, so to speak. So yeah, that's my response. Thank you.
Yep. I just wanted to add to the question on culturally relevant interventions. I think it's important for us to understand how do cultures experience, climate change. Different cultures experience it differently. So, like the Western way of understanding may not apply to many cultures. However, and in my research, I've seen that people cannot relate climate change with mental health. So that relationship. So one needs to understand. So there's a lot of indigenous knowledge that is there, but in much of the research that we do with young people is, I will not say what is the right intervention, is to try and co-create these interventions with young people. First, understanding what it is, trying to draw the parallel between the two, and co-creating these interventions. There is no like, this is the right interventions for the right. I think there's no straightforward answer to that.
Thanks. Yep, really brilliant questions. I'll try and consolidate this. First to the decolonization question. So obviously, in a way, I'm from Australia as well, but living in the UK from a very global north perspective on this. But hearing voices from around the world, we hear how climate change itself is an extension of colonization, an extension of these extractive practices, an extension of this incredibly unequal power and the people who suffer versus the people who are causing that suffering from their actions. And we want to make sure that the climate and mental health field doesn't perpetuate these existing inequalities. And we heard in Connecting Climate Minds the importance of community-led research that also ends up benefiting that community, because people were saying, we've had researchers come, we've told them our stories, but has things got better for our community? What happens to our community once we've shared this data and these stories? So not only having research that's led by that community and with that community, but that ultimately benefits those communities. So we're working now in Australia, actually in the Philippines, on a youth project to understand how different cultures, different peoples are experiencing the climate crisis and co-design, implement and evaluate supportive interventions. But the young people are advising us and actually now saying, you know, we want to be the ones that are leading the interviews. And so they're leading the focus groups. We're helping them as people with experience of research, but they're the ones who are going to be leading those discussions. And yeah, but there's a long way to go. We know that most of the research that happens in climate and mental health happens in high income contexts, even though a lot of the impacts are in low income contexts. So there's a lot of work to go that, and money needs to go into field building. Money needs to go into platforms for connection, platforms like an observatory model that Gary Belkin from Coptic Squared is trying to build with us at Connecting Climate Minds, to connect people on the ground, to connect the researchers that can support that evaluation and scaling up and sharing around the world. Join the global online hub of Connecting Climate Minds. We tried to translate everything into different languages that are relevant for those regions. The dialogues were offered in multiple languages. So we're trying, but there is a long way to go, and we're trying to be led by people who have much more knowledge than me, sitting here as a white woman from the global north. In terms of the education point, I just wanted to say that we hear this a lot from students, but also from teachers, from university lecturers, from scientists who are saying, we need to communicate the facts, we need to tell the truth, but the truth, quite frankly, is incredibly scary. Like the more I learn about how close we are to potentially passing global tipping points, I mean, how do you hold that? It's an existential threat. If you're not emotional about that, then, you know, are you human? What's going on here? You know, teaching the facts which need to be taught, and I'll come to the age appropriate way, but that needs to integrate mental health. And so we're working again, Climate Cares, on a project at the moment that's looking at how we integrate climate and mental health education. And so we're working with teachers, with students, and with organizations that are already starting to do this and provide these resources of what is needed, what works, and how we can support teachers so they feel equipped to have those conversations and deal with the distress that comes up. But there is also a huge benefit to making sure from the mental health side, to embedding that also within geography or in climate conversations, so we don't separate out mental health, because this climate conversation, it affects everyone. So we don't want to make sure, you know, it's something where, and we hear this from people around the world, that sometimes in contexts where mental health is really stigmatized, when you start to talk to people about how they're feeling after a disaster, you know, everyone's gone through that. So it's a level playing field in a way. Of course, people experience it differently, but the tools that we need to cope with the climate crisis, of sitting with uncertainty, of building our ability to regulate our emotions, of strengthening our social support, building our agency, if we can teach young people that in the context of them feeling empowered to take action for the future that they want to see and imagine that world, and be part of that, and be part of processing that and digesting that together with each other and with themselves, that will be good for mental health in general. So we don't have to isolate mental health or climate education, but we really need to integrate them. And in terms of doing that in an age appropriate way, that's also a big question. We've got a climate journal, a guided journal coming out, but that is for sort of teenagers and emerging adults. But there is a big gap in work with young children, actually, because it's really difficult from a research side to get ethics for it. But that is something we're aware of, and others are working on it. I'd be happy to follow up. But yeah, it is, how do we also show the world that we can be creating, the future that we can be creating through our actions, and creating hope that way, as well as sharing the facts about what's happening. But yeah, happy to follow up.
Thank you, Emma. And is there anyone else who wants to add before I can go ahead? No. Okay.
Oh, John, I think.
Okay.
Very little to add to those fabulous answers. I mean, I would underscore what Dr. Daniel said, that you know, within the United States, in terms, you know, which has many populations that have suffered from colonial kinds of activities, but especially our indigenous Americans as well as African Americans. These are communities that on the one hand, have many things that they're dealing with, and climate change is often not the number one driver even of stress and emotional distress. And so that has to be recognized flat out. That coming in and saying, oh boy, climate change is really bad, and I'm sure you're really worried about it. We've got, that's a non-starter. It's recognizing the cumulative stressors and the intersectionality of the hazards and the traumas that those communities are dealing with, and without recognizing that, the interventions will also not be effective. But secondly, these communities have, by tragic requirement and tragic necessity, have developed many mechanisms of resilience, which is why they're still, here and coping and managing with all of these things. And so tapping into the indigenous, as you said, mechanisms of resilience that combine, many centuries of living through climate variability and resilience to climate variability with more recent centuries of other historical traumas, and tapping into that and building on that strength is very important. And just in terms of the age appropriateness, one of the things, and I'm not an expert in early childhood education by any means, but one of the things that our group did was to take, like, there's a whole bunch of coloring books, and there's a program called Ready Wrigley, and Wrigley's a rabbit who helps to teach kids about various kinds of disasters and how to think about to kind of build a little bit of resilience, a little bit of anticipation in young children towards different kinds of disaster preparedness. And so that's one way in which taking first of all, integrating into things that exist, and second, meeting kids where they are and bringing in elements of it without perhaps the whole scientific picture, obviously, at an early age. But there are things that can be done to help them. Yeah.
I also just wanted to add a very small point that also builds on what Ayo was saying in terms of not necessarily reinventing the wheel. Like, there's actually quite substantial material coming from, for example, the disaster mental health space or from the conflict space that can be really useful in these kind of situations. So there's, again, the point that John was making made me think about a really helpful resource that is called My Hero Is You, that was developed by the World Health Organization in the context of COVID, and that speaks about how you break down complex emotional topics to children, which might be a helpful resource to have a look at.
I guess it's my turn now. So I'm going to try to sum up what I echo what everyone has said over here, but I'm also a young person who's a peer educator, so possibly that might shed a little bit more light. It is true that connecting climate change to mental health is quite hard, but if you remember at the beginning of my presentation, I showed you the social determinants of what really causes mental health. It's just that climate change is exacerbating this and accelerating it. You can't really tell someone, can you care about your mental health, when they don't have safe drinking water, when they don't have a roof above their head, when they don't know when their next meal is. If you compound all of that and say that climate change is exacerbating it, you're probably going to put them in a very strong existential crisis and be like, oh my God, what am I going to do? And that's really not helpful, right? Let's face it, it's not. But when we talk about the decolonization perspective, my friend's a decolonization researcher, and I've heard a couple of his stuff, so I'm no way an expert. But what he says is we really need to capitalize on the information that people are aware of. And I'm not just talking about young people in this space. I mean, I'm pretty sure older people in this space also feel stressed about climate change. We do have a panel here that is quite intergenerational. We're all worried about our future, but we come with some kind of an understanding of what we're really experiencing, even if we're not really able to explain it in the exact words. So the way that I try to break these conversations down is, how are you feeling today? How often have you asked that question to somebody? How are you today? Did you have a glass of water? Did you sleep well last night? And really make them feel comfortable in that, okay, if you've not had that, what exactly has made you feel that way? And then you slowly see that this person feels like they're going to open up. And then you're able to actually ask them about, okay, what is really causing this issue for you? How can I be there? Sometimes you don't have to really physically be there for someone. Just having them really rant out makes a huge amount of difference. Like I've seen so many of my friends who are just like, oh, knowing that I'm not really alone in this space has really given me that kind of support that I need because well, we're together, and that makes me feel slightly a bit better. It doesn't make me feel really great, but I think we can talk about that in our next therapy session and really opens them up to the conversation about, hey, can I go to therapy? Will therapy really help me? Which also really brings into the fact that we do need more psychologists being more climate informed because I know that psychology and therapy itself is quite difficult. And this is someone who's been in therapy speaking because I feel really uncomfortable after every therapy session. I'm like, I don't want to go back. Now, if you add that to climate anxiety and I say, oh, I'm working in the public health space and I'm talking about all this, someone is just going to say, then why work in the space? That's not helpful again. So I think it's all about can I really build that human connection and conversation and just try to understand what the other person is saying rather than explain to the other person what I think would be best for them, but to find a solution that would co create what would be best for them. Regarding the age appropriate education, because I also work in the SRHR space, what I've realized is it comes down to how much do you care about something and how passionate are you about ensuring that you take care of something that you love. For a child, this could be something as simple as, oh, do you know that you have an animal? Do you know about the animals that exist? Do you care about the animals that exist? I mean, just touching a dog very sweetly, or a cat if you're a cat person, or anything about that. Taking care of a tree, watching it grow, taking them out into the sunshine, watching them play in the playground. I think those small things really build that connection into nature and environment. And that automatically means that you will start taking care of nature and environment. Or even like local gardening practices. Like my mom has a garden on our rooftop, and every day she comes and she's like, Harshita, did you see this little tomato that we grew? Did you find this berry? It tastes so good. You know, it doesn't taste like it has pesticides in it. And I'm just like, I mean, obviously you grew it, you didn't add any pesticides to it. But I think that's a small action that's creating, you know, this bonding with nature that was so lacking. And I think that's also something that Indigenous people who are guardians of nature have been calling for in so many of their talks, saying that we have been coexisting quite peacefully with nature. Why are you not replicating these processes and these things that we have? So, yes, while hard facts are important, I think it's also about where are we bringing in our shared humanity? Where are we finding these interconnections and these interlinkages in our system? And the role that education can really play is that we need to also call for like these education systems to be changed. Because when we look at education systems, it's always usually quite didactic. And I don't think that's helpful at all. While it does help in a younger age group to actually inform them, okay, these are the kind of knowledge that's there. When it comes to perhaps middle school, high school, or even teaching college students, because I know that I can't sit through any of my medical classes. I'm just like, I can find this information on the internet. I can just find this information on YouTube. At the worst case, I can just listen to a TED talk at 2x speed and get what I need. But can you make this interactive? Can you build on the knowledge that I already have and also inform me better about what exists? So I think from being a peer educator and all the lived experiences that I possibly have, these are the things that I would say and recommend. But I would also like to close off this panel because we're short on time with one closing remark and call of action from all of our panelists, perhaps. And then if you want, you can grab us like right outside because I know they're going to kick us out at the dot of 2:45 to ask us if there's any extra questions. So perhaps from you, Dr. John Balbus, we'll just move this way. Quickly, 30 seconds, one call to
So
action.
one thing that we haven't talked a whole lot about is hope. And the one thing that I would just close with is we need to be looking at the information that's given to our children, look at our media, look at our social media, and make sure that we are not, you know, there are motivations there to show the worst and the scariest and the most spectacular and the most horrifying news in order to continue to sell the news, to make sure we're providing the positive information. I think about people like Catherine Hayhoe, who, you know, has a newsletter that capsulizes that. So, you know, we've been a little doomy and gloomy up here, and there's a lot of reasons for hope. And I think that we need to make sure that that everybody is aware of them, because it's much easier to be aware of the downside.
Yeah, so I'll just say, like I said earlier, we already have solutions. Young people are working. So what we need now is just more funding, more resources, and support for young people who are facing the mental health impacts of climate change. Like climate change is upon us right now. Like we are facing it presently, and the psychological impacts also. So like I just think we should take action, support young people, give young people money. To be honest, like we just want money because we already have solutions. We are beginning to co-create. So yeah, just funding and resources and support for young people. Thank you.
I speak from a global south perspective. It's important to understand what's happening first. Only then we can strategize interventions. I think that's my take.
To go ahead.
I think we've heard throughout these days that all of the decisions that are being taken in these weeks are ultimately also health decisions. So I think whatever aspect of COP you're following, whatever track you're interested in, I think being aware that the decisions that are being made as part of that are going to impact people's physical and mental health is something to bear in mind. And I think in terms of what personally people can do, I think we all live in a place, and that place will have policies around air quality, around heat, around disasters. Look up whether your policy includes a reference to physical or mental health. Does it include a focus on children? And what can you do to make sure that that happens?
Yeah, thanks so much. Yeah, I love this point around that we also need to center hope and see hope not as a passive thing, but as an active thing, as hope as a verb, as some people would say. And that requires that vision of where we're trying to go, you know, even in sort of small steps. And there is a lot of power in the human imagination. And because these crises are all connected, once you start to have a systems perspective and see the connections, you can start to see how the solutions are interconnected as well. And when you start working, wherever you start working from your school, or you start working from your perspective, whether it's gender or water or human rights, whatever it is that you're working to achieve is part of this bigger picture of human health. It's a part of the bigger picture of climate, you know, all of these challenges, and therefore opportunities are interconnected. So I would love to see work funded that does acknowledge and support that need for connections, for networks, for capacity building, and investing in, as Ayo said, the solutions that already exist. We hear so much from communities, Indigenous communities, different cultures, different groups in society that they're already doing this work. We just need to show it, invest in it, scale up. So again, just as a shout out, some of our case studies are on the Connecting Climate Minds Global Online Hub if you want to see some of the great work that's being done by people around the world, but there's lots more. And that requires listening to fundamentally. We heard in the Pacific about Talanoa, which translates to no talk, and listen and really listen to each other. And yeah, there's big potential ripple effects in the way that we show up, and in the way that we do things, as well as the how, as well as the sort of what. So yeah, I think there's a great strength in the mental health community and being able to encourage kindness, being able to encourage listening, being able to encourage connection. And I think that we shouldn't underestimate that power in how we show up for our work, and how we imagine a vision of a healthier future that we're working towards.
Thank you. I'm not sure how I'm supposed to close after that. But our climate is changing, and so we must change too. And I think together we've heard from the horrible impacts to the potential that resilience, hope really has. And we have the opportunity to create a beautiful life together, to work together to create a system change that is needed. So if there's anything that you take away from our panel today, I hope it is this: our collective voice, our resilience, and our initiatives that's creating a healthier and more resilient tomorrow. Thank you.